Arbor Ridge School cafeteria. Bob?
Amy, thank you. New at 7, Molar City. Yeah, odds are you've never heard of it, right? But it's a tiny little town, Los Algodones in Mexico, quickly becoming one of the dental capitals of the world. We're talking about thousands of people every year crossing the border and getting some serious dental work done at a fraction of the cost. We're talking about things that could run you thousands of dollars here in the States, going for just a couple of hundred down there. But the question is it worth the risk? Let's talk with Scott Schmidt. He's a prosthodontist here in Central Florida. Good to see you, Scott. Nice to have you here.
Thanks,
in this country, we don't just let anybody work on anybody else. You got to get educated first. I'm assuming you've been well educated. You had to get a license. You had to get all of the proper credentials before you started becoming a prosthodontist. But that's not necessarily the case down in Los Algodones, is it?
Well, it's certainly true that in my practice I did go through specialty level training.
Of course.
For the treatments that are being carried out in these countries, I think it's important to understand that these are potentially very high-risk treatments.
Okay.
And we need to make sure that the dentists who are carrying them out are, yes, qualified, have proper credentials. I know on the internet today it can be very hard to discern marketing versus true qualifications.
Now, there are some people that go down there and say they're perfectly happy with what they had done, but how do you know what's the good one and what's the bad one? Because there's basically there's just row after row of people offering dental care down there.
Correct.
Right.
Correct. I believe that it is certainly very hard to decide where and when you should get a treatment like that. The thing that I'd like to emphasize is that treatment like this is, again, it is costly, but it also comes with a very high risk. Whenever you are considering a permanent and irreversible alteration to your body through surgery or high-speed instruments, you need to be very careful about who you have do that treatment, because the consequences or the risks may be much greater than you originally expected.
You've had people from foreign countries who've had work done come to you to get help and get it fixed, right?
Correct. So as a prosthodontist, I'm trained to help probably the most difficult and the most challenging of dental problems. So in my practice, especially over the past couple of years, we've seen an increase in really the victims of dental tourism.
Can I ask you this? What would be the worst thing that could happen? I mean, some people were bleeding too much because they had like thinning blood. I've heard of that. But what's really the worst that could be done? Death?
So, yeah, sure, I suppose death would be the worst case scenario, but let me draw another analogy, and that is, I think all of us would be attracted to maybe buy a discounted pair of shoes.
Sure.
We say that's a risk that I would take. Now, if they told you that if the shoes didn't work out, you might lose your foot.
Right.
Then you might think about it a little differently.
Right.
And what the dental patient needs to understand is that it's actually not your tooth that's the most important issue in your mouth. It's actually your jawbone and the gum that surrounds it.
Absolutely.
Especially when dental implants get involved in these complex treatments. When a dental implant fails, it can take a significant amount of the jawbone with it.
I gotcha.
If you have multiple dental implants placed, then you could lose a very significant part of your jawbone. And after that, we may not be able to rebuild that.
Okay.
You truly become almost like a dental cripple, where you may not be able to be restored without, significant impact on your quality of life.
Scott, I'm way out of time, but if people have more questions for you, how can they get in touch with you?
I have a private practice in Altamont Springs where I'm very happy to treat
Got a website?
People in most need.
Okay.
Yes, it is schmidtprosthodontics.com.
Okay. Scott, good to see you as always. Thanks for coming in early. We appreciate it.
Thank you, Bob.
All right. Jamie King, how we looking?